Did you know that nursing isn't just about clinical skills? Behind every practice, there's a theory. Let's dive deep into the minds that shaped our noble profession. Hello to all my fellow nurses and nursing students out there. It's Martin, aka your Danish male nurse. And today we are exploring those giants upon whose shoulders we stand. 5 influential figures that have shaped nursing as we know it today. And the first one is of course no other than Florence Nightingale, known as the Lady with the Lamp. Florence Nightingale is widely regarded as the founder of modern nursing. She revolutionized patient care with her emphasis on hygiene and the environment. She is most known for her book Notes on Nursing. It's a foundational text that's still referenced today. And in the description I have some link if you are interested in some videos about her or if you want her book. But wait until the end before clicking them because you don't want to miss out on the upcoming theorist. But before we move on to the next theorist, we have a little known fact about Florence Nightingale, which is that during the Crimean War, Nightingale and her team reduced the death rate from 42% to 2%, primarily through improving hygiene practices. And next up is no other than Virginia Henderson. She provided a clear modern definition of nursing, focusing on the 14 basic needs of patients. Her work, The Nature of Nursing, remains a pivotal read for every nurse. And I actually believe that 80% of my assignments in nursing schools, I used her theory, which is why I made a full video analysis of her theory. And here's a little tidbit for you. Henderson believed that patients would recover more quickly if they were mentally engaged with their treatment, something we are still struggling to implement today. Moving on, we have Dorothea Orem. She's best known for her self-care deficit theory, emphasizing patients' role in their own care. Her self-care deficit theory of nursing has influenced countless nurses to promote patient independence. And Orem started her nursing career in the emergency room, a challenging beginning that no doubt influenced her perspective on patient care. Let's not forget about Jean Watson. Watson's theory of human caring delves deep into the emotional and spiritual aspects of nursing. Her book, Nursing: The Philosophy and Science of Caring, is a testament to her holistic approach. And I have a little heartwarming fact. Watson personally founded a scholarship to help nurses further their education, something I will delve more into informing you about, so make sure that you are subscribed and have clicked that bell notification icon so you get notified every time I upload a new video. And last but certainly not least, Madeleine Leininger. She pioneered transcultural nursing, underscoring the importance of cultural sensitivity in care. Her book, Cultural Care, Diversity and Universality, is a must-read for those looking to provide culturally competent care. Leininger was an avid traveler and believed that experiencing different cultures firsthand was crucial for understanding patients. These 5 theorists have left an incredible mark on nursing. Their ideas, practices, and principles continue to inspire and guide us. And if you want to get smarter on the people who formed modern nursing, then check out this playlist right here. I dare you to push it because it will make you so much smarter on the people who formed modern nursing.